What is a sit rep?
Will you give me your situational report?
Oh,
Everything's good to go over here at SD1.
All right. Is that Leo?
Yes. Sorry.
Cool.
Good morning.
Good morning. Who's this?
This is Freddie Marion.
Hey, Freddie. Goodwill.
Yes, SD3. Good morning, teammates.
good morning.
Cool.
Good morning.
Cool. Good morning.
Good morning.
Good morning, ma'am. Who's this?
This is Cassandra Vanterpool, and my partner will be on in a minute. We are co-founders of Life Source Oasis here in the Antelope Valley. I'm a Vietnam vet, she's a Marine vet, and we are collaborating with Thrive LA to build a tiny home village for homeless veteran women.
Fabulous, Cassandra. We're so happy you're on, and I'm sure you're already collaborating with Jimmy, and he'll be on as well. I just wanted to say good morning to everybody. I'm Christina Barraza with SoCal Grant Makers. I am the director for veteran programs and an Army veteran, 24 years, retiree. Yes. So yeah, here we are. Good morning, Rocio Romero. Good morning, Jessica Zarley, Epan. Great to see you all. We're waiting on Ms. Tesbenko and Mr. Jim Zenner to jump on. Good morning, Valerie and Rhonda and Linda Larson. Wow, I see all these women veterans, you know, and that's one of our initiatives here in partnership. Hey, Omar. With LAVC here is what we're trying to do. Good morning, James. Cool. Veteran engagement. All right. Yeah. Anyone have a good morning story, motivational speech for me before Tess and Jim come on?
Sure. Do y'all know that tomorrow is Navy birthday?
Did not.
Yes, tomorrow is Navy birthday. I don't know if y'all are aware, but we were born a long time ago. I think it was like 1774, and we were, or 1775, I'm sorry. And we started out, one of our first ventures was a little submarine called Tortuga, and we were out in the water.
Which is turtle, right? In Spanish.
Yeah, it means turtle. Yeah, it means turtle. And so for a time, they decommissioned us after the Revolutionary War because they didn't think they needed us anymore. But guess what? They brought us back because they saw how important it was to how important we were to be there. So we were one of the two original branches as the nation was young and growing. And so I'm just telling you, I know all of us are proud of our branches, and I'm just really proud to be in the Navy. I'm proud that the first active duty official permanent position went to a Navy woman. The first official Navy woman, the first official woman active duty member was a Navy member. The first ever was a reservist, and she was in the Marine Corps. But then they came us, and then we have just historically, we were the first ones to fly. I was able to witness that, the first women to fly fighter jets. And then I was on active duty when women started being put on the big ships. And so I'm just really excited to be a veteran of the Navy and to have been around to watch all these historic things happen. Some of them good, some of them bad, such as the tailhook scandal, which really started the sexual harassment conversations in the military. But some of them were really positive, as having all these firsts, meeting Kathleen Connolly, I believe was her name. She was the first Navy personnel to be on the space shuttle. So all these things were really exciting to watch, and I just wanted to share that with you guys. So happy pre-birthday, Navy.
Thanks, Lucille.
Wow.
Did someone else have something to say? Man, Rocio, you would be a great partner in one of those shows where, you know, you have to name off like all sorts of facts. Yeah, definitely choosing you. Anyone else have any great news or anything you'd like to share before Tess and Jim come on? I saw somebody say go Army. Go all branches. Yes, absolutely.
Hey, good morning. My name's Andrew Strain. This is my first meeting, but I'm from the VA Greater Los Angeles Planning Office. I work pretty closely with Tess on some of the housing efforts that are underway, and excited to join this meeting. Thanks all for welcoming this morning, and to provide any updates on planning initiatives by the VA, Greater Los Angeles healthcare system, and the Western LA VA, or any of our other CBOCs. But yeah, thanks all. Also, that was exciting news earlier about the Veterans Tiny Shelter Initiative. We've got some experience working on that at the West LA VA. So if you want to connect, I'm happy to share any lessons learned and what we've done locally here.
Fantastic. So thank you. Thank you for joining us and making the time today. We look forward to any other updates later on. We'll ask. Yeah, and as Amy says, if you could just please add your contact information in the chat so we can continue to connect and communicate with you throughout the month. Perry, I see your hands up. Perry Goldberg.
Yeah, hi, good morning, everybody. Nice to see people. I participated in this Veterans Collaborative many times, but not so really the founder of the LA project, and our goal is to create housing and jobs and community for returning veterans and others in the Antelope Valley. And as Cassandra mentioned, we're collaborating with LifeSource Oasis. And LifeSource Oasis has purchased land in the Palmdale area. And we have been making great strides recently toward having a pilot project that will house and provide jobs for 6 female veterans. So we're really excited about that. And we are basically at the stage where we want to be recruiting our veterans who will be part of this pilot project. And the project is going to revolve around a collaborative farm that the veterans will work on site. So we'd love to connect with anyone who's doing similar things and would be interested in working with us.
Fantastic, Perry. Thanks for sharing, and thanks again for being here today. We really appreciate it. Anyone else? We'll start off with anyone who's new to the group, or yes, Sadie Tolberg. Oh, my Army veteran sister. Please.
Hello, everybody. This is my second meeting, so I'm still fairly new, but I just felt called to give a PSA today. We are coming into the holiday seasons. Yesterday marked 75 days until Christmas. What do you think of when you think of the holidays? I know for me, it is stress, it is expectations, it is traditions, it is all of the things. And sometimes it's loss and grief because we are spending time without loved ones. It reminds us of people who are no longer with us and things like that. And so this is your PSA to think about your mental health this season and to really look at your brothers and sisters left and right, all of our demographics, everybody, we're here to help, and check in on them a little bit extra, hug your loved ones a little bit tighter, and just know that there are lots of resources like the Cohen Veterans Network, which is what I'm here representing, that can help with anything mental health in this holiday season. So thankful to be here, excited to meet all of you, and Merry holidays.
Thanks, Sadie. Oh, you brought up warmth to the group. Thank you so much. We appreciate it. All right. I think Jackie Ball, and then we'll go to Brock Young. Jackie?
Hi, well, this is Jackie. I'm not camera ready, but I'm like Sadie. This is my second meeting. I am retired Navy, but before that, or after I retired, I worked as a veterans employment representative in Massachusetts, and I worked in the cities of Everett and Cambridge. So I just want to be connected. I'm actually visiting my daughter in Los Angeles now. And so that's one way I heard about the group. So I'm just trying to learn as much as possible. So thank you.
Thanks, Jackie. Aren't we all just trying to learn everything we can, and together it's better. So thanks for being here. Brock Young.
Hello, everybody. Christina, thank you very much. Everybody, again, I'm like those that came before me. This is my second meeting. My name is Brock Young. I'm the Deputy Director of the San Francisco Federal Executive Board. We're a federal agency located in Northern California. However, I'm also the facilitator of the Veterans Federal Employment Collaborative, and a collaborative of federal agencies and volunteers trying to get more veterans into the federal service. So that spans nationwide within the FEB network. as well. I am retired Army National Guard after 24 years. So go Army. There's a reason the Navy beats the Army every year, because the Army's busy fighting and winning wars. So there we go. But I appreciate everybody that's here. I'll throw my contact information in the chat box, and please don't hesitate to send any veterans or transitioning service members you might know that are interested in federal employment. Send them our way. We'll see about getting them connected. The VFEC's motto is one more veteran hired. After that, one more, just one more. So that's us. Thank you very much.
Thank you, sir. Cool. All right. Anyone else who's new on board today? Let's see. We have Terry
Yes.
Sykes. Oh,
Sorry about that. I didn't want to cut you off.
no worries,
Brian here with USS Battleship Iowa. This is my first meeting, entering my third week here with the VPEN. Little bit of my history and stuff. I started my homelessness career within the homelessness community. Started off at PATH SSVF over at San Fernando Road. I see some of my previous peers here doing bigger and better things. Rudy, Mario, hey guys. So I went over to PATH SSVF, then I went to the Salvation Army Bell Shelter. I was there throughout the whole pandemic, and then here recently I came aboard on the USS Battleship Iowa as a housing coordinator, trying to settle in, and hope to be in more of these meetings and get to know everyone. Oh, and it's about the Marine Corps, right? Right.
thank you, Brian. Always bringing up the rear, right? That's good. Love it. All right, Terry Sykes, and then we could go over to A. Cathaway and Freddie, then Guadalupe. Terry?
Hi, my name is Terry Sykes with the California National Guard. I'm a soldier and family readiness specialist, actually in the Monterey Seaside area, but I'm working in Irvine this week. My counterpart Omar is probably on this call as well. He invited me here to be with you and just learn more about the services that are available in this area. Besides being a member, civilian member of the California National Guard, I'm also a Army reservist. And to bring it back from the Marine Corps, my husband is an active duty Marine, we're taking it back on the Army side and saying, good.
Thanks, Terry. Your mic's a little echoey, so just so you know. All right, A. Cathaway, please.
Hi, Christina. My name is April, and I'm sorry I'm not camera ready today.
That's okay.
This is my first meeting. I just wanted to introduce myself. My coworker Laura Falcon and I are here. We just wanted to be a part of the meeting to get to connect with a lot of people here and know more about programs that are available to veterans and the homeless in the LA community. So I'm a registered nurse, and I am from Community Connect. We partnership with Adventist Health, and our main goal is to provide or to identify social determinants of health in our members, social determinants of health, such as lack of housing, access to health care, transportation. We work with patients who are, or members who have substance abuse, mental health disorders, and the homeless with chronic conditions. So after the meeting, maybe I can send you some information more about our program, but I just wanted to say, I really appreciate all of you, especially those who have served in the military. I have a family, military family as well. So I just wanted to say thank you for having us.
Thanks, April. Thank you for being here. All right, Freddie, you're up.
Good morning, teammates. My name is Freddie Marion. I'm the new service coordinator for VPAN SD3. A little bit about me, I'm a retired Army First Sergeant, 27 years active duty. I retired here in the San Fernando Valley where I grew up. I was in charge of the San Fernando Recruiting Company. I'm just happy to be surrounded by veterans, helping veterans. So I'm just glad to be aboard and looking forward to meeting all you teammates in person one day. Thank you.
Cool. Thanks, Freddie. Welcome to the team. All right. Always. Kelsey Gutierrez, you're up.
Hi, I'm Kelsey Gutierrez. I'm with VPAN over here in Iowa. So I actually just graduated college last year. I'm in the National Guard. Right now I'm a platoon leader. So it's been really great learning. I love what we're doing. I'm a peer battle buddy, so I'm really looking forward to being able to just help veterans, help the service members. It's something that's very special to me, and I care a lot. I care so much. I think a lot of service members, they don't receive what they really should be receiving.
Thanks, Kelsey, and thanks for your continued service. All right, Lupe Orozco.
Hi, good morning, everyone. My name is Lupe Orozco. I'm here representing Mental Health of America of Los Angeles Military Resource Center. I am the new program coordinator, so this is my first meeting with you guys. So I'm just here trying to see what information I can share with you guys, as well as gain, more information for our veterans.
Thank you, Lupe. You'll have a lot of notes to take today. All right, Jennifer Fritzl.
Hi, good morning, everyone. I'm Jennifer Fritzl. I'm with the U.S. Department of Labor Women's Bureau. I'm so happy to be here. Thank you for inviting me, Amy. And I'm a Navy veteran, hoorah. And I will share some really exciting news just because I'm a proud mom right now. My son joined the U.S. Air Force. He checked into basic training last night. Aim high, wish him all the best luck. And I'm happy to be here. Thank you so much.
Oh, Jennifer, what sweet news. Thank you for kicking us off like that. And good luck to him and you as well, and for your service. All right, Erica Smith. Erica? We'll come back to Erica. Charles.
Hey, hi, I'm Charles Johnson. I run the Veterans Resource Center, Los Angeles Pierce College. I'm also retired Navy, 26 years active duty, Army. Okay, I'll give y'all that. But I'm Navy. So I do have a little request for anyone out here who can help me with this. The leadership team at Pierce College would like to interdict with any program where they can do something personally, not like a Veterans Day thing where they can put together a package or give something or somehow connect with some organization for them to show that they're doing something, not like a Veterans Day thing, but like the presidents, the VPs, and the deans. Just the leadership team wants to do something, whether it's putting together a package or anything. So any organization that think that they might want this kind of support, and it's not like one-time thing, they might want to do it as an ongoing thing. I will put my information in the chat. Please contact me, because they would like to connect with someone where they can show that they are doing, they want to have to do something hands-on for themselves, and they want to do it at their leadership retreat. So any organization or anyone that think that they want like some kind of services that can be provided by the leadership team at Pierce College, and they are paid for it, of course, it's already funded. Please contact me. Thank you.
You're at the right place, Charles. You got a lot of shakers and movers here. And like Sadie said, over, I don't know how many years of military experience, family and member. All right, Erica, you're up.
Hi, thank you. I'm at the Safe Haven Tea House through VOA here on Skid Row. We house homeless veterans, male veterans. I'm here as a returnee. I was part of this meeting several years ago, so it's good to be back. But I wanted to let everybody know about our program. We're new and improved. We've gone through a remodel courtesy of the Dodgers. We have tons of beds available. We offer lots of services for veterans, whether it be employment, head vash housing. We have an on-site MICM clinic for the severely mentally ill. We have an on-site primary care clinic. We have a lot going on. So if you guys have any veterans that need a bed, please contact me. We have tons. We're here to serve. Thank you.
Thank you, ma'am. Jason Slauson.
Hello, can you hear me? Hi, I'm a veteran. It's my first time. I'm here. I was Amy Pila Bravo suggested I come check this out. I'm here to talk about barriers. I just wanted to introduce myself and say hi. So
Thanks, Jason. Thanks for being here. All right, Leah Carpio Hernandez.
Good morning, everyone. I work with Jen Fritzl with the U.S. Department of Labor Women's Bureau. I want to say thank you to everyone for, having this program, allowing us to be here. Your energy this morning is, just amazing. It's a great way to start everyone's morning with such great enthusiasm. I am not a veteran, but I am here to support the community and uplift all of these good programs that I'm hearing about. And I'm excited to talk more with you all later.
Awesome, Leah. Thank you. And the energy is here. All of us together. All right, Ms. Jennifer Morales.
Hi, good morning, everyone. I'm Jennifer. I work with Union Station Homeless Services. I'm one of the CES matchers. My focus is SPA 3, so Pasadena all the way out to Pomona. Part of my role is to help when veteran project-based resources come up online for us to match. It's my job to go to work with the homeless veterans in this coordinated entry system and help try to link them to the available resources that we have. So I just wanted to say hello, and I was invited to attend to check out this meeting. So thank you so much for having me.
You've got it, Jennifer. Thanks for being here. And last but not least, James Schotter.
Well, hey, y'all. It's good to see everybody again. I'm James. For those of y'all that don't know me, I was previously with the VPAN VOA team. I see a lot of my former team there still putting in work here on the call, and I've been able to work with some of them since I've left. I'm now with MHALA in Long Beach with the SSVF team there. So glad to be here serving SPA 8. So definitely looking forward to continue working with y'all.
Thanks, James. Well, gosh, what a lovely group of people that I will now pass on to Tess Benko. There you go, sister.
Hi, good morning. Sorry about that. And thank you, Christina, for picking up the flag and running with it. I absolutely love our team and all of the veterans in the county. Just a really, really great community of support and expertise. So as you all know, this is the LA Veterans Collaborative. I'll go ahead and share my screen to share with you our agenda. Sorry about this morning. I had a little bit of a technology issue, so I'm just going to stay off of camera for now and guide it this way. So I posted in the chat the working group chair contact list, the link. So those are your subject matter experts. If you have issues or challenges for the veterans that you're serving, or you just want to get in touch and network in these different arenas, we have about 15 working groups through the LAVC. So I posted that link in the chat, and you can also find it in the agenda and minutes. This link never changes. So anytime you want to see what happened in the meeting or the report outs, you can always come to this link. So save it on your computer or shoot an email, and I'm glad to send it. So we have something called the LAVC Learning Community and Message Board. There are events listed on there. It's really a communication mechanism for the county, all of the peers. So if you can go on there and sign up, there's a lot of great information. I just want to welcome everybody again. We got through the introduction of the new participants. There's a contact list for organizations that are represented that I posted in the chat. I will also repost this link if anyone's joining us late, so anyone can access that and put their information in. Feel free to email those that are on the list. As I mentioned, it's public information. Our mission, a collaborative group where veterans and families in need, peers, service coordinators, and county officials can access systems and engage with each other through communication, collaboration, and service delivery. We're also rolled into the VPAN, the Veteran Peer Access Network efforts in Los Angeles County, and the new LA County Unite Us platform, which is the service provider platform where you can refer veterans and family members who might need help or resources. There's also an accountability component, and we examine reporting data that we get from this group. So it's a really great marriage of boots on the ground through the VPAN, Unite Us, and the subject matter experts who come to these meetings. We have standing reports. So I want to go ahead and see if we have a federal government update today. I'm not sure if we have, Janet Turner usually joins us from Ted Lieu's office. I'm not sure if she's with us today. But if not, that's fine. We'll move past that and go into our local government update. Do we have Robert Alvarez with us? Okay, I know there's a meeting going on, a competing meeting today, so they might all be at that, but the VSO legislative update. So Richard.
Yes, I'm here. What I wanted to inform everybody about is that there's a lot of press releases that have come out from the VA that many of you may not be aware of, dealing with, for example, the VA program for comprehensive assistance for family caregivers is expanded and covering all areas of veterans. The expansion of the PACT Act, eligibility signups for all veterans. That's important, especially right now, to get them to go to the local VA medical centers and join up for their health care. It's on now, so that's an important thing. So there's a number of press releases with vital information for grants that many of the participants in the collaborative would be wanting to have that sort of information so that their particular organization can apply for specific grants. So all those press releases I'll get out to Amy and to Tess so that it can go out to the rest of the members of the collaborative. But most importantly, though, again, and I can't overstate this, is the PACT Act and getting the veterans to start signing up for submitting claims. It's important that they're aware of their eligibility, covering all areas of veterans that have been exposed, whether it's burn pits, Agent Orange, Gulf War veterans, veterans that were exposed to radiation and other hazardous materials during their service. It's important to get them, to encourage them to go to the local VA to sign up for healthcare eligibility. Another important aspect of that, and it hasn't started yet, but we're looking at sometime in the November timeframe, where the VA is going to begin screening of all veterans. And the initial screening will then be put into a database, and that screening process will happen every 5 years for the life of the veterans that have joined the VA eligibility and have gone through the initial screening. So that's important, and the more we can get to participate in that, the more comprehensive care that our veterans will receive. So it behooves us as members of the collaborative and the veteran community to encourage all veterans that we're in contact with, if they haven't already filed a claim, to get one going. If they haven't already gone to the VA for eligibility on their health care, to encourage them to do so. And an important note with regards to the claims aspect, VA is gathering those claims, but come January, February timeframe is where veterans will begin to hear the status of those claims that they had filed. So in effect, VA is gearing up, VBA is gearing up to be able to process those claims in a timely manner. So it behooves us, it's important on our part that as we encourage veterans to join the system, that and file their claims, that they understand they're not going to get an immediate response, but that come January, February is when things are really going to be put into gear and move forward. So long as they understand that, they won't get frustrated with the system. There's legislation that's still pending that will be taken up again once the midterms are over during the lame duck session of the 117th Congress. So I'll be providing information on those important bills what we really need to focus on with our local legislators to ensure that there's passage of these very important bills. And I'll be providing that information as we move forward with a priority list. Lastly, what I wanted to go over is there's one bill that's waiting to be signed by the president. And that's the Senate Bill 1198. And the title of that bill is the Solid Start Act of 2022. And I'll be providing that information as well with regards to the key components of that bill. And one that really stands out, and this is for women veterans, is that if that bill, there's a section in it provides women veterans with information tailored to their specific health care and benefit needs. And in the last floor vote on that, there was a big brouhaha. There was the minorities on the in the House wanted that particular section taken out, and but smarter heads prevailed and it stayed in. We're just waiting for the president to sign that bill now. So as soon as that goes into effect, I'll let everybody know. And but it was an important aspect with regards to women's health care. So as I said, I have a lot of information that I'm currently collating and preparing to get out to everybody. And as soon as it's ready, you'll get it. That's what I have for now, Tess.
Awesome. Thank you, Richard. I saw that Janet Turner joined us. Janet, do you have any news from the federal side? Are you still on? Oh, she's in the waiting room.
Hey, Tess, this is Andrew Strain from the
Hi, Andrew.
Greater Los Angeles. Hey, sorry, I'm new to these meetings, so can defer to Janet, but I can provide some updates on behalf of the VA planning office in Los Angeles. I think probably the biggest news, and hopefully folks are aware of this, is the opening of the Ventura community-based outpatient clinic that began serving veterans on Tuesday, September 27th. I'm really excited about the expansion of service in Ventura. This is a VA-operated clinic, so it's VA clinicians and staff. I'll drop some more information in the chat about this new clinic, but I would encourage everyone who's in the Ventura area to check it out. It's a really great facility located at 5250 Ralston Street. Then on the West LA VA, for anyone who has been on the property recently, you'll see there's a ton of construction activities underway. We're very excited about the permanent supportive housing that's under construction. I think there's about 179 veteran permanent supportive housing units for veterans experiencing homelessness. They're expected to open at the end of the year and start to lease up early next year. So excited about that progress, and working very closely with Tess and her team to plan tenant selection and help get those units filled very quickly. There's also been progress on the new dietetics kitchen building, which serves meal service for all the VA operations across this healthcare system. That's on the South Campus, and we'll replace a building on the North Campus that would then be converted into permanent supportive housing for veterans. And then also some progress with our partners in LA Metro in construction of subway station. Metro continues to work on infrastructure and utility reroutes. This will be a great resource for veterans living on the property to access downtown, and also for staff to be able to get to this West LA VA a little bit more easily. So excited to continue that partnership. Those are kind of some high-level updates. Lots of infrastructure work also happening to just upgrade and repair old infrastructure that will support the housing and other facilities on the property. But if you have any specific questions, want more info about what's happening, let me know. Share that. Thanks, Tess.
All right, awesome. And I saw that we had Janet Turner join us as well. Janet, do you have any updates?
He did it all. He did a great job of what's firm to tell you. And as Richard said, some things are pending. So look forward to having much more to tell you at next meeting. And finally got my computer audio and camera to work. So looking forward to being part of the rest of the meeting. Thanks so much, guys.
Awesome. Thank you, Janet. Maybe that's where my my functionality went today, to your computer. Okay, so let's jump back down to the VPAN. Christina, again, thank you so much for pinch hitting with the issues, but are there any updates specifically on VPAN? And if you'd like, please take us to the VPAN rally point updates as well.
Yeah, for sure, Tess. Thanks, everyone. Again, I'm Christina Barraza of SoCal Grant Makers. And just three things I wanted to touch on. One was the assist training coming up in December. It's for everyone. It's a gatekeeper training that VPAN puts on through a partnership with JVS. And it's going to be at the Chimbole Cultural Center in Palmdale, 14-15 December. And this type of training, it's for anyone who is interested in it. So if you're thinking, I don't know what it is, you know, it sounds good, but can I get some more information, please? It's a 2-day interactive workshop in suicide first aid. It teaches someone who may have thoughts of suicide and to work with them and to create a plan that will support their immediate safety. So if you want to feel more comfortable, confident, I'm confident in helping prevent this immediate risk of suicide, this 2-day workshop is for you. So please let me know and I can get you in on that. Second thing is the Women Ambassador Program within the VA. And so we're looking for women veterans who would like to be appointment escorts, Safeway home escorts, VA coaches, full battle buddies, similar to what we have in VPAN. It's not a full-time, it's a part-time, it's a volunteer position, and you would go through some training with the VA. It's a half-a-day training. You would go through a little background check, and then you'd be able to bring some of our veteran sisters over to access the healthcare at the VA. And third, ETS, expiration term of service training. So it's a sponsorship program for those that are coming out of the military, and you know, we're just like fish out of water. And so it's nice to have someone that has been there, done that, and is now successful in the community, and you know, knows people, knows how to navigate the systems. So we're always looking for sponsors. Basically, a person that comes takes an 8-hour training, which we do have one coming up at the in-person LAVC in December. So if you're interested, reach out to me. I'll get you registered. It's easy, doesn't hurt at all. I promise I took it. And last, I'd like to leave you with a little quote. If it doesn't challenge you, it doesn't change you. Your first sergeant is out. Thanks, Tess, and thanks, everyone. Have a great day.
All right, so moving forward into the rally point updates, we'll go with SD1. And do we have anyone from SD1?
Yes, I'm here. Good morning. Good morning. My name is Leo Trinos. I'm the VPAN program manager here at SD1 with JVS here in South El Monte. As far as updates, we did have 11 outreach events this past month of September. We actually hosted one at LA Trade Tech, which is a really great venue. So we were able to make contact with a lot of new veterans not really familiar with VPAN. That worked out well. Also, we have the top, and I'll go into our services provided from our SD. Our number one supportive service was for income support. Number 2 was individual and family support. And 3 was our housing and housing support. And as far as upcoming events, we do have one coming up tomorrow at the East Los Angeles College, where there will be, it's the Charlie Mike Continue Mission. It's from 11 to 1:30 tomorrow at East Los Angeles College. And we also have something in the works with, this is for December, but I'll report it out now because we're really excited about this. We're partnering with the 155th CSSB, Army Reserve, and Cal Vets to assist with their dining out event. So look forward to that. That'll be December 10th is the date we're shooting for. And as far as any barriers, we're still looking for more resources for families, maybe non-military members, as far as housing support. And that's one of the things we're still running into some issues with that, but we're working on that. But definitely that would be our only barrier that we have right now.
Great. Let's move on then to SD2, Volunteers of America, Los Angeles.
Good morning. My name is Christina Reingold. I'm the program manager for VOA LA. SD2, we're located in the city of Compton. This past month, the outreach events that we did was about 8. That includes the weekend stand down that we hosted with the Compton's Chamber of Commerce along with the Long Beach VA. Our top 3 services that we are providing is individual and family support along with housing and benefits. And then with our barriers, we're continuing to see a high need for rental arrears. And something that I did want to be more specific on when I say rental arrears is we're seeing people that have that are behind anywhere from like 2 months to 6 months. And with that, it's like anywhere from, you know, $6,000 up into being $20,000 behind on their rent. This also includes veterans that may own businesses who may have had to close their business for a few months due to COVID, which caused them to be behind on the rent, behind on their utilities. And so trying to work with multiple different agencies to you know, kind of work with those high costs, that's been a challenge. The other thing too is veterans and families that do have housing vouchers, we are noticing that there is difficulty getting them permanently housed, whether it's timely, meaning taking time to get the voucher. Maybe once they do get voucher, there's been a little bit of obstacles once they do locate housing due to extra fees on top of the rental cost. So still just definitely some barriers for us here in District 2. Outside of that, that's all I got.
Great, thank you so much. And I'm sorry to hear about that. I know housing is a real challenge throughout the entire county. SD3, Goodwill SoCal.
Good morning, teammates. My name is Freddie Marion again. This is my first time doing this briefing, but I'm enjoying it so far. I'll get into our outreach events. We had 2 events where we were able to connect with over 21 different veterans. Going into our upcoming events, right now we're trying to partner up with a local team here in our community to try to schedule something for Veterans Day, so more to follow. Going into our top 3, our number 1 was benefits navigation, followed by employment and individual, family, and support. As far as barriers, right now, we're just short-staffed here in our SD, our rally point, but we're working on hiring some individuals here shortly. Other than that, we don't have any barriers identified.
All right, thank you for that.
Thank you.
Sorry to hear about the short staffing. Are you all planning on releasing any positions for hiring?
I think so, yes, ma'am. My program manager, Terrence, is in the process of doing that now. More to follow on that. I've been on ground for about 30 days, so I'm just getting the feel for the position.
Congratulations, Freddie.
Oh, thank you.
All right, let's go to SD4, USS Battleship Iowa.
Hey, morning, everyone. For SD4 outreach events, we had about 15 outreach events that we attended this past month. Upcoming events for this month, we have a Lakewood Connect event. It's hosted by Path and the Life Center Church. And that's going to be Friday, October 14th from 09 to 1300. And then also October 29th, I don't hablo español, so I might mess this up. We have the Dia de los Muertos event in Downey. It's going to be at the Downey City Hall. And that's from 1100 to 2000. So we'll probably have 2 teams to staff that, a morning and an afternoon team.
We also have one this in Downey on the 20th, which is next Thursday. It's the Robot for Life. It's a seminar for veterans to transition from civilian life to getting a job. That's going to be at the the Downey Library from 9:30 to 4 next Thursday.
And then our top. Go ahead, Brian.
No, go ahead. I was going to say,
Okay.
go ahead and take it.
Our top 3 services were benefits navigation, individual and family support, and then housing and shelters. And then for barriers, one barrier we're seeing is transportation for elderly veterans, especially to get aid and attendance, because if they don't have a caregiver already, it's kind of hard to get them transportation from their place of residency to the VA, especially if they have stairs and whatnot. It's kind of hard. Another ones I think we're seeing similar to SD2 was the tentative HUD-VASH vouchers, finding them housing that accept the voucher, and then also large rent arrears. Hopefully with Brian P. just joining our team, these barriers won't be as impactful in the months to come.
Yes, let me add to that. That's what I'm here for. Hopefully to go ahead and assist with those barriers. I did get James Schroeder point of contact for SPY SSVF. I would definitely be going ahead and reaching out to you. If we do have a point of contact for SPOT 7, if you could go ahead and shoot me an email or a text. My information is there. First name Brian, last name Palomera. I gladly appreciate that. Thank you.
That's it for SD4. Thank y'all.
Thank you so much, SD4. And just let me clarify, Dia de los Muertos, what day is that on?
That's October 29th, Saturday.
All right. Thank you. And let's move on to SD5, JVS.
Good morning, everyone. My name, for those that might know or not know me, I am the program manager here for SD5. So outreach events, we've held about, I want to say about 15 outreach events. The upcoming events that we have coming up is we're going to be at the we're going to be tabling at the Edwards Air Force Base Air Show on the 15th. We won't be doing both days. We've been doing a lot this last month. So also we'll be tabling at the Battle Boutique, which is going to be held at Post 43, October 21st. For those that haven't registered, I say it would be cool of you to do it ahead of time, so we could have an actual count of what's going on. If you haven't done so, if you haven't reached out to your women veterans, then it's shame on you, especially if you're a provider out here. And I'm shaming everyone across the board. So make sure you reach out all your women veterans that are probably in your AOs or within your capacity as well. Top three other events that we have coming on is I know we also have the Supervisor District 5 at Sousa Armory, and also Santa Clarita Annual Golf at Valencia Country Club. So those are the other events that we'll be going to. I have a secret event coming up in November, but I'll leave that for November's update instead. Just because I'm very dramatic in that sense. The other thing I want to say is, let's see, for the top 3, we have our first one for the first time ever. So number 1 for this month is always going to be benefits and navigation. Housing and shelter took 3rd place this month, and income and support came in 2nd. And whoever's typing this, I did that on purpose to mess with you. The barriers that we're dealing with out here in SD5 is usually some of the things that we've been running into is being able to get in contact with the SSVF for providers. Even though we have their contact information, emails, the only thing I'm missing to do is sending messenger pigeon out. But overall, it's just having a hard kind of challenges is getting in contact with, like, to be able to advocate for some of our veterans that need support. The other thing is being able to kind of get a clear, concise information on through the SSVF program, what it looks like to now they just switched over to subsidy. I can't even pronounce that word today, but yeah. So I know there's been a couple of new changes on that as well. So that's another challenge that we've just been running into, is being kept up to date of the new policies that are constantly being changed in the housing community. The other thing that we have going on as well, I think one of the ones that Matt also mentioned is transportation out here. A lot of veterans they have to go down to like Sepulveda VA to just get their services, even though we have a CBOC clinic. I have a lot of mixed reviews when it comes to the CBOC. Some people love it, some people don't. It's a hit or miss, you know. But then that's something that we hear across with any VA provider. So other than that, let's see, what else do we got? Oh yeah, so I know there's been a couple of other challenges with some of our veterans with the SPF program. So I know that they're trying to they feel like they're not being supported. So that's the other side of the coin as well. Just all I'm saying is what I'm hearing from from our spectrum. Other than that, that's all I have for everyone. Hope everyone have a wonderful day, and Tess, back to you with the news.
Thanks, Jimmy. And no, you weren't able to trip me up with your little reversal there. All right, homelessness and housing. Do we have our homelessness and housing team with us today?
I believe they're actually attending the USC Summit this morning, so they will not be joining us.
Okay, that makes sense. Moving on to Unite Us. Anil, do we have a presentation this week or any updates?
Yep, we sure do. Amy, if you could share real quick. I apologize, my technology has also been challenging for me this morning, Tess, so I'm in your boat.
Yes, 1 second, let me find it.
I can do some high level that I know off the top of my head in terms of branch that we do serve. Army was #1 this month. And then #2 was Navy, then Marines, then Air Force. So just in terms of branch and who we serve, if we look at gender, 78% male, 17% female. It did go down a little bit this month. I was excited to continue seeing that number rise for female vets that we've been, female service members that we've been serving. But it went down from 22% to 17% this month. So just always something that I look forward to seeing and sharing with everyone. Next slide. And we look at 639 new clients across, again, the Unitas platform with our agencies in terms of a VPAN, in terms of agencies that we work with. 682 referrals, right? So I always think that's important and interesting to see is we had 639 new clients, but we still had 682 referrals, which means past clients still need referrals, other clients that we've been having on the network. And then 972 service requests. So that's also important. Not only did they have more referrals, but some veterans, some family members needed multiple services. So always being able to connect, and how are we being really intentional about who we connect our veterans to, so they can get all the services in one place, or they can try to get to somewhere where they're not having to go and try to find the next person, the next person, the next person. Next slide. I'm excited about this one. We do have a new to the top 10 for sending referrals to LACU. I don't know if anyone is on here from that agency, but Veterans Upward Bound program. So that's their logo. Wanted to pull them up. Excited to have them to the top 10 for sending referrals in the Unitas platform. Our average time has stayed the same, a day for referral acceptance. So that is exciting that that's not increasing. If we go to the next slide, quality of care, I think that's always important. So I will say this is something for us to really look at. So 35% of service episodes were resolved. That's 12% less than where we were last month. Now, I'm not saying that we have to always have this perfect resolved rate, but how can we continue to push and challenge and get to those resolved opportunities? And resolve looks different for every individual, every client, every case. And then our number of episodes not resolved would make sense because that went up. So the green just meant the percentage went up. The red means percentage went down. So just something for us to continue looking at. And we do have a lot of open service episodes. So wanting to make sure that we are continually supporting. There's a lot of individuals that need our supports. So if we want to go to the next one, the quality of service is also important, but then also looking at homelessness, suicide, and underemployment. So I will say this month was our biggest month in terms of housing cases not resolved. 61 housing cases not resolved. That's usually been, I would say, historically under 10. Maybe it's gotten to 15, but this is the largest month that we've had with housing cases not resolved. So just something for us to continue looking at. I heard some of the rally reports saying that housing was a challenge this month. So that is consistent with everybody's reports. Employment, 84 open employment cases, 32 employment cases resolved, 3 employment cases not resolved. Mental health, 47 open, 15 resolved, 21 not resolved. That one was also a little bit bigger number. Go ahead and move to the next slide. I'm excited to share this. So top 10 for receiving military and veterans affairs, they have one more month and they'll have been the top one for a whole year. And so that's always exciting. Then VPAN SD2, SD1, SD3, SD4, SD5. So you guys can look on that. And then I know StackUp has been on here in the last 2 meetings, and this is the first time they are the #1 for sending referrals. So I'm excited to say that they dethroned VPAN SD2 that's had that title for 4 months. So congrats, StackUp. Thank you for your work and continue to send referrals through our platform to make sure that we can connect our vets to the services that they need. Next, these are the top services, or top needs. Housing and shelter is #1. Benefits navigation, right? So those two from all of last year, benefits navigation was 1, housing and shelter was #2. And as of September right now, housing and shelter is #1, benefits navigation #2. So those two have switched spots. Employment has gone down in terms of top need, which is exciting. Maybe we're helping support some vets get into those jobs, get those resources. Individual and family support has gone up too. Income support has kind of stayed that same throughout that year. And then last is trends. So if we look at trends, that gray line that we see at the very end that has that 289, that's housing and shelter. So we see that's jumped about 100 this month. We see that benefits navigation jumped down a little bit. Employment stayed steady. Income support has gone up a little bit. Individual and family support has gone down just a little bit. Mental health has stayed, a little consistent, and legal has gone up. So always looking at those trends to see what we can do, how we can support. So please let us know. I know that for a lot of individuals and teams, the different teams, that the data has changed on the Unite Us platform. I know some of you have reached out, and we are also working to figure that process out in terms of the reports, in terms of being able to answer any questions. So absolutely, we will make sure that we can support you. It will take a little bit of time. The data is changing, so we just want to make sure we get all that information. So please, if you have any questions, reach out. I'll put my information in the chat. We appreciate you guys. If you need it and have any questions, my information is in the chat.
Thank you, Neil. And typically what we do is move into a sound off portion, but here we are at 10 o'clock a.m. We're about ready to start the main body meeting. So what I'm going to encourage you to do is to visit the chat. There's a link there, the LAVC Learning Center, for links and information posting. Also, please, if you have any kind of challenge or you want to reach out, we have that list. I'll post it again of the different working group chairs. There is no wrong door to getting assistance or referring veterans. Unite Us is great. VPAN you can refer directly to as well. VA sections. There's just a lot of help available. So feel free to reach out if you have an issue or a particular challenge around serving veterans and families. Thanks for joining us. We'll see you again next month.
Thank you, Tess. Again, the meeting is not over. I did want to take this opportunity to allow Jason, who at the beginning of the meeting mentioned that he had a barrier that he wanted to discuss. And having several different organizations on here who are championing change and removing barriers for veterans, I wanted to give him the floor to kind of express that need and see how we can help him. Jason, are you still there?
Yes, I am. So very quickly, a little over a year ago, I was contacted by VRNE. I had just moved into the area and they set me up with a bunch of stuff. And the representative I had talked to someone in Maryland a few years ago, and they said that the GI Bill, I had some mix up because I swapped over from Montgomery GI Bill to post 9/11. So there was something going on. They said I ran out of it. Fine. Then when I talked to the counselor, he said, no, there's a lawsuit that happened. We're going to be able to get it for you. No problem. I was like, are you sure? Are you 100% sure? Because if I do school, this is an intensive school, so on and so forth. So I signed up for school, did it. He got harder and harder to get a hold of. About a year later, my wife reached out to Congress people, contacted people, kind of put a press on him. And then I got this kind of blast back from the VA that said, hey, you don't qualify for Montgomery GI Bill. We went ahead and extended your voc rehab. Thank you very much. And since then, I've been bounced around to 2 or 3 or 4, well, I think it's 2 or 3 different counselors, and all of them keep coming back and saying the same thing. I applied for extensions, a bunch of other stuff, and I just keep kind of hitting a wall. So I don't know how to proceed in trying to get whatever this guy was talking about, Chapter 33, BAH, all that sort of stuff. Because it is getting increasingly more and more difficult to continue doing school. I have less than a year left. And you know, bills pile up and money gets short and all that. So I'm just trying to figure out how to proceed, how to move forward, and what to actually be able to do, because I feel like I'm coming up against a wall here.
Hey, Jason, this is Linda Larson with the Wounded Warrior Project, and I would love the opportunity to discuss your situation. I think that we have some programs and services that may be helpful to you. And
Okay.
I just connect with you on LinkedIn.
Awesome. Thank you.
Right, are there other connections or links? Please also feel free to put information in the chat as well. All right, Jason. Well, hopefully we can find some assistance, further assistance, and thank you so much for sharing your challenge.
Thank you. Have a good day.
Tess, real quick, I'm so sorry to barge in. I did put a contact person of a person who's extremely helpful. We all know him, David Fierro. David will get to the bottom. If you are referring to Chapter 31, because you mentioned VRNE and then you talked about Chapter 33. Chapter 33 is a post 9/11, which you only get 36 months.
Yes,
there is an extension. There's a possibility for extension if you're within STEM, but there's an application you need to submit. But if you're referring strictly to Chapter 31, I did put David Fierro's contact number. He is a champion of veterans, so please reach out to him directly. Most of us here know David, and we can attest to how hard he works in advocating students' rights and so on, especially when it comes to Chapter 31.
All right, we've got a hand up from Audrey Champ.
Hi, yes, everybody. I have a barrier that I'm kind of working on right now. And since, you know, you invited Jason up, I thought I'd jump in here and ask. So what I'm working on right now, it's a barrier that my amazing team leader, Matt, mentioned earlier, was that we have a veteran who is a senior veteran. He's an elderly veteran. He's 91, which is pretty good, you know, in terms of life, you know, and but he does have an appointment at the VA to get qualified for aid in attendance. We're looking for transportation for this veteran. I've already reached out to the VA, Transport Us VTS, and they let me know that because he hasn't had an assessment, and this will be in his initial assessment, that they cannot, they can't support him in this getting him to the VA as the initial, for his initial appointment. He can have the assessment once he's here, but getting him here is the issue. He lives in Redondo Beach. He'll be coming to Long Beach VA on the 18th. And I've also tried to go, ask about his insurance. The insurance will not, because he's coming to a VA, they do not provide transportation for that as well. I did look into Unitas, and there were 2 options that did not cover his service area. So I was just curious if anybody else had any leads maybe that I can follow up on. I was typing a long message in the chat, but I figure speaking it out loud is a little more effective. So if anybody does have any resources, that would be so wonderful. That is all I have. But yeah, thank you guys so much. This is an amazing network, and I appreciate you guys.
Thanks, Audrey. I put that in the chat as well, so feel free to put your contact information. And if anyone can help, please come forward.
Maybe everyone already knows all about LA Access, but it's very easy to qualify. They'll come to your house, his home, and they'll give him door-to-door transportation in one of their accessible vans with lifts, wheelchair lifts, and he makes the appointment 1 or 2 days ahead, I think, and pick him up, take him home. LA Access, it's run by LA County. And it's free or $2, I'm not sure, but it's nothing. It's minuscule if it is.
Thank you, Laurel. Thank you so much for providing that information. And I know we went over time a little bit, but I think it was important to hear some of the barriers from people experiencing this directly. Jason, this will not get lost once this meeting is over. We'll continue to navigate through our resources to see how we can help support you. Okay, next, we're going to go ahead and jump right into our main meeting. Thank you all so much for sticking around. I know it's such a long time, but it's very important to discuss some of the programs that are available to us. Some of the champions that we're focusing on. So with that, Rocio is there. I know she wanted to discuss the Battle Boutique, which is going to be our first ever event that mirrors Operation Dress Code that takes place in Northern California. Rocio, are you available? Okay, I think she may have lost some connection. So moving right along, we do have the U.S. Department of Labor. They introduced themselves earlier during Access and Engagement. So Leah is going to be talking about the Women's Bureau and how we can help collaborate and work together and how they could support some of the work that we do. Leah, the floor is yours.
Hi, thanks, Amy. Can I go ahead and share my screen? Is that possible as an attendee?
You should have the access to share your screen on the bottom.
Okay, great. I just wanted to make sure. Let me go ahead and do that. Okay. I think this is working.
Ma'am, I can see it.
Perfect.
Yep.
Okay, well, good morning, everyone. I'm happy to be here. As I stated before, we are happy to be invited to speak with you all. As I said, I am Leah Carpio Hernandez. My pronouns are she, her. I'm a program analyst with the Women's Bureau Western Region. I'm joined here today with Jennifer Fritzl. She's also a program analyst with the Women's Bureau Western Region. All of our slides will be shared after the event. Our slides have many QR codes throughout, and we hope that you find these useful for direct Women's Bureau information. So today I'll be covering the Women's Bureau, who we are, what we do, our organizational structure, our mission and our history, our priorities, and our work. There'll also be time for a Q&A session if there are any questions for us. So the Women's Bureau recently went through a reorganization. We moved from a 10-region office down to a 6. In our office in the Western region, we cover all of the West Coast there in orange. So that's Alaska, Washington State, Oregon, Idaho, Montana, California, Arizona, Nevada, Hawaii, Guam, American Samoa, and the other Pacific Islands. I'm physically located in Los Angeles. Jen is physically located in San Diego. But again, this is the region that we cover and all of the states that we do work in. So let's talk a little bit about our mission. The Women's Bureau champions policies and standards that safeguard the interest of working women. We advocate for the equality and economic security of women and their families, and promote quality working environments. I next want to share with you our newest fact sheet. We have it in both English and Spanish. These QR codes will send you directly to the fact sheet, but again, these will be provided for you after today's discussion. The fact sheets kind of give information similar to what we're doing here in this presentation, but they're really good resources that you can share, you know, with your networks or with the individuals that you serve as well. So a little history about the Women's Bureau. We were established 102 years ago on June 5th of 1920. The Women's Bureau is not an enforcement agency, but we are the only federal agency mandated to represent the needs of working women in public policy process. As I said in our mission, this includes advocating for the issues that impact working women, which can include things like working conditions and opportunities for profitable employment. While the Women's Bureau does not write public policy or policy changes, we have and continue to contribute to the laws that affect working women, such as the Equal Pay Act of 1963, the Pregnancy Discrimination Act of 1978, and the Family and Medical Leave Act, also known as FMLA, that was established in 1993. Excuse me. So the Women's Bureau has 3 priorities. We established these priorities in 2022, and they will continue on into 2023. Our first is creating pathways for women into non-traditional jobs and raising wages in jobs where women primarily work. Our second priority is ending the disadvantages women face as the primary care providers for their families. Women often take care of children, elderly, or disabled family members. The Women's Bureau helps these caregiving women by advocating for access to paid leave and other worker support systems, including care benefits. And third, we also address workplace discrimination against women. We often partner this priority with other federal agencies, including the Equal Employment Opportunity Commission and the Office of Federal Contract Compliance Programs. So how does the Women's Bureau work towards these priorities? Well, we have 3 main primary working goals. So the first is research and policy analysis. The bulk of this work is completed at the national office level in Washington, D.C. The second is our grant programs offerings, and I'll talk more about those shortly. The third is our stakeholder engagement, and this is the core part of what the regional office work is, what Jen and I do here in the Western region. We are responsible for building partnerships, educating our communities, and engaging in outreach, such as today's event. Now let's talk a little bit about our grant work. The Women's Bureau has 2 great grant programs. Our grantees were recently announced and for this year. And for more information on all of those great grantees, you can go to the QR code, and the link to our grants page is actually provided in the slide deck as well. So our first grant is the Fostering Access, Rights, and Education. This is also known as our FAIR grant. This grant is awarded to organizations who provide outreach to women who are paid low wages at work and otherwise are marginalized or are underserved. Their work, these grantees' work can include sharing educational material through various platforms, assist women workers with navigating and calculating benefits, connecting and referring women to other services related to the workforce, including benefits, legal assistance, and anything else these underserved women may need. Our second grant is the Women in Apprenticeship and Non-Traditional Occupations, also known as WANTO. This grant is awarded to organizations who do one or more of the following. They develop pre-apprentice or non-traditional skills training programs to prepare women for these types of careers. They provide ongoing orientations for employers, unions, and workers on creating successful environments for women to succeed in these non-traditional occupations. They also set up groups to facilitate and network for women and provide services for women to help the retention in these non-traditional occupations. So again, if you'd like more information on our grants, you can always reach out to us and we can answer more questions, or you can go directly to our website to get a little bit more information about those. So this slide gives information about research that came out of the national office earlier this year. In March of this year, the Women's Bureau published the Bearing the Cost Report, how overrepresentation in undervalued jobs disadvantaged women during the pandemic. The findings from this report indicated that working women were more severely impacted during the pandemic for two main reasons. They take on a greater share of family caregiving, which I just discussed, which increased during the pandemic. And two, they were overrepresented in occupations and industries that experienced the largest job losses, such as in restaurants, retail, and education. For the first time in a modern recession, women saw worse employment impacts than men. More women were pushed out of the labor force between February and April of 2020 than men were. Women of color were hardest hit by the economic impacts in 2020. Black and Hispanic women had the highest unemployment rates in 2020. American Indian and Alaska Native workers saw their unemployment rate spike in 2020. And Asian women not only had to deal with the economic crisis, but also a dramatic increase in anti-Asian discrimination and harassment. For more information on the Bearing the Cost Report, again, you can find this information on our website or utilize the QR codes in the slide. These two items here on this slide are recent research promotions or research products that have actually come out from the national office as well. The first is 2 years into the pandemic and how the pandemic affected women ages 65 and older. And the second here is the National Database for Childcare Prices. The Childcare Prices database gives a list of all of the counties in the United States and gives a comparison number of childcare prices within those counties. The data in the National Database for Childcare Prices is very new. We are hoping to roll out more of a consensus on the page. If you are a data nerd and you really enjoy getting into data, right now that page is definitely for you. However, in the coming months, we hope to refine that page. So it's a little more user-friendly for somebody who's more of a novice when it comes to data research. But please, by all means, still take a look at it if you are interested in having more of an understanding of childcare within the counties that you work within. Next, I wanted to share with you two additional fact sheets that we released this year as well. The nursing and pregnant workers. This is offered in both English and Spanish. Again, you can utilize these slides or these fact sheets and share them with your the individuals that you serve or any of the individuals that you work with or coordinate with. Let me just share with you the Spanish version, just so you can get an idea of what it looks like. And let's jump into data. So as I said, we do a lot of analysis and data work from our national office. So if you go to our webpage, we have a wealth of information on our data page, which includes this example here under our earnings. This is an example, excuse me. So this is the employment and earnings by sex and race, exploring equal employment opportunity data map. The Women's Bureau released this interactive map recently, and it provides employment and earnings data for full-time workers at the state level. This data is available for men and women across 7 race ethnicity groups and in 236 occupations. The data is designed and best used to look at differences by sex and race within detailed occupations in particular states, such as food service workers, bus drivers, or even childcare workers. But I really want to have you all focus on this section of our data. We do have a women's and veterans data section that has 5 data pages dedicated to women veterans. Please visit our site to view more on these pages. I think something that may be particularly interested to this group is the data on unemployment rates for men and women by veteran status and their period of service. But again, all of these data pages may be of interest to you. You can go directly to our page and go under our data site to find this information, or you can utilize the QR code that is also on this slide deck. As I stated, the Women's Bureau is doing a lot of work. We also release blogs almost monthly. We have a topic blog that comes out, and these are actually written by staff, not just national office staff, but also regional office staff. These two items on the slide here are just examples of kind of the storied blogs that we write. If you sign up for our newsletter, you'll receive information on these blogs. The two that I listed here, I thought would be of interest again to this group. So expanding career paths for women. This was actually written last year, but I still thought it was relevant. And the second is centering equity and inclusion in job creation and economic development. And this one came out a little bit earlier this year in February. So let's take a look at what the regional offices actually do, right? What Jen and I work on. We partner with other DOL agencies to create programs such as this. We do Know Your Rights events. We've done roundtable events, but we do partner with other DOL agencies. If anybody who is in attendance today is interested in creating a collaboration or Know Your Rights events with us or our sister agencies within DOL, that is definitely an opportunity. You know, we work frequently with the Office of Disability and Employment Policy, known as ODEP, the Office of Federal Contract Compliance Programs, OFCCP, Veterans Employment and Training Services, VETS, Employment and Training Administration, ETA, Occupational Safety and Health Administration, OSHA, as well as Wage and Hour, and a cohort of others. We don't just work with DOL umbrella agencies, we do work with other federal, state, and local agencies as well. These examples include the Equal Employment Opportunity Commission, the Health and Human Services. At the state level, you know, we've recently created relationships with the California Labor and Workforce Development Agency, the Office of the Arizona Governor, specifically their tribal affairs representatives. So we have partnerships with a variety of local, state, and federal agencies that, you know, we can collaborate with you all on if we find that there's a collaboration point between us and any of you all in the audience. We also partner with community-based organizations. A few of those, you know, we have such a vast list of these, but just a few that, just a topic point, we work with Tradeswomen Network, Nevada Works, the Nevada Women's Business Center. We have a collaborative that comes out of Northern California, which is the Bay Area Equal Pay Collaborative, that works towards sharing information on equal pay for women across the state of California. We also have a San Diego 2Gen working group network that talks a lot about childcare and how to access services, again, within San Diego and the surrounding area. As I stated, with our partners, we conduct efforts in all of our states throughout our region, which include Know Your Rights webinars. We do have 2 equity series programs that are coming up. So we do Know Your Rights events. We do kind of events where we have panelists having discussions. So similar to those events is what's coming up for us. So we have a disabled workers, women workers event that's coming at the end of this month on October 26th. And we also have our veteran celebration. So celebrating women's veterans, She Served Too, which will be conducted on November 9th. We will share that information with Amy, and she can hopefully share that with you all as well, if you're interested in joining us on either of those. We also work on community engagement, which, as I stated before, can include roundtable discussions to understand the specific needs of labor communities. I know coming up for us this year, we're very interested in talking with women veterans, agriculture workers, union workers, as well as American Indian workers or urban American Indian workers within community. So that's a little bit about what we do regionally. Last but not least, I want to just share some information that is supported by the Department of Labor. This is the Worker Organizing Task Force page. So if you use the QR code, it will take you directly to the page. The White House Task Force on Worker Organizing and Empowerment is mobilizing the federal government's policy programs and practices to empower workers to organize and successfully bargain for their employers. with their employers, excuse me. This task force is chaired by the Vice President, Kamala Harris, and also vice chaired by the Labor Secretary, Marty Walsh. If you go to the website, it provides a wealth of information that includes the Know Your Organizing Rights. The task force is leading an initiative to increase awareness among workers about their federally protective rights to organize and collectively bargain with their employers. There's also information on worker organizing. The task force is developing a resource center with information on unions and collective bargaining for workers, unions, employers, and researchers, and policymakers. And last but not least, the union also has a reporting mechanism within the page. So the task force is committed to collecting and producing and analyzing more information as it relates to labor unions and worker organizing. So you can get more information on what is happening in the country at a union level and get an understanding of what's happening across the country. So just to tie things up, this is how you find us. If you're interested in our data, you can utilize this QR code here. If you would like to sign up for the Women's Bureau newsletter. Now this newsletter QR code is for the Women's Bureau in totality. So you'd be getting information from the top level at the national level. So that would include information on our blogs or other research that's coming out. If you're interested in getting on our newsletter for the Western region, which may have more applicable information for you, or maybe you want to sign up for both, you can always email us and we can get you on our Western region newsletter. The last QR code there is for our events calendar. The events calendar with that QR code covers all of our Women's Bureau events across the country, and many of those are virtual. So even though you may be physically located here on the west side, if there's a topic point of interest in that's coming out of one of our other offices, you're more than happy to join in us virtually. So I do have our contact information here. You can reach Jen or I at our corporate email, but we can also share our personal email in the chat. If you're somebody that likes to talk on the phone, you can always give us a call as well. And again, I just want to thank you all for allowing us to be with you today, to share this information, to start a conversation on a collaboration point. I know just from hearing you all talk earlier this morning, I think there's a lot of point of contact for us to collaborate on things moving forward. I know Jen and I plan to be at the Battle Boutique next week. So hopefully, we'll be able to see some friendly faces as well. And as I said in the beginning of this presentation, we're definitely open for questions. So yeah, that's really all I have to share. Let me go ahead and stop sharing my screen if I can figure that out.
Thank you so much, Leah. If anyone has any questions, please feel free to unmute or raise your hands and ask your questions.
Let's see.
Yes, I just wanted to mention, my name is Demetrius Vandergriff, Commissioner Vandergriff for City of Carson Veterans Affairs, local veteran employment rep with the EDD, State of California, in LA and South Bay. And I just want to say thank you for that. My youngest sister has a nonprofit, which is about promoting women's health issues, emphasizing fertility and resources. And I certainly sent her all of the screenshots of this. I think it's really good. And hopefully you all will be able to create some symbiotic connection and be able to share some information. She has a 501c3 called Women's Inc., which stands for Women's Ovarian and Medical Exchange Network. And so at any rate, I just wanted to say thank you.
No, thank you for that. Yeah, if she's interested in talking with us, she can always send us an email. I know Jen just listed our corporate email there for contact. And as I said, we'll also be sharing these slides with everybody in attendance today. So you can share any of the slides and the fact sheets with her as well.
Thank you. I sure did. I already emailed them to her. So and again, thank you.
All right. No, thank you very much.
Wonderful. We do have a Zoom user, Cassandra, with their hand up.
Hello, everyone. I introduced myself earlier, and one of my colleagues from Thrive LA is here, Perry Goldberg. But I just want to say this is my first time being invited to this meeting, and I tell you what, you folks really have it going on. I live up in the desert, so we don't get to hear too much in Palmdale, California, but rest assured that either my co-founder or our vision lead, Perry Goldberg from Thrive LA, we will be contacting quite a few of you. I can almost guarantee it. And I just want to say thank you for everybody, everyone's efforts in view of veterans and veteran women. I myself, as I said before, I'm a Vietnam veteran, female from the United States Air Force. I was an aircraft mechanic. And as coming out early like I did, coming from, well, not retiring, but leaving the Air Force system, back in the day, we weren't ever, we never were really informed of what our rights could have been or should be. So I entered the Veterans Administration medical part in 2007. And it was there that I received a lot of my skills and tools for my toolkit in order to be able to handle PTSD and a plethora of all the other traumatizations that veteran women have and have endured. So once again, I just want to say you guys are on it. I so do appreciate each and every one of you. I'm amazed that, because if we're not with you, if we're not attending your meetings, how do we really hear about from all the other plethora of organizations that are really doing something for the veterans? And I just want to say thank you, everybody, for such a great effort and an intense variety of interests, because you work there because you love it, what you're doing. So I just want to say I can't thank you enough. And I live in Palmdale, California, and the co-founder of Life Source Oasis, as Mr. Goldberg had alluded earlier. We are a nonprofit. You can find us on Facebook and lifesourceoasis.org or .com. Thank you so much again. See you next time.
Thank you so much, Cassandra. And again, thank you so much, Leah, for coming here and letting us know about this program. A lot of us have a really strong passion of making sure that women veterans feel appreciated and know their value and worth. So thank you for coming here and being able to present that information. And next we have another presentation from We the Veterans discussing Vet to Vote. So Ms. Ellen Gustafson, the executive director, is here from that organization to inform you guys of the work that they're doing. Ellen?
Thanks. Thank you so much, Amy. Amy, do you have my slides to pop up?
Yes, ma'am.
Awesome. Thank you so much. Really, really thrilled to be here. Super grateful that this Vets Collaborative exists. I've heard about it from our good friend, Nate Grazer, and wow, what an incredible resource for the greater Los Angeles community and for the country to see this as a model for how to make sure that we are collecting and servicing as many veterans as we can. As the slides come up, I'll tell you a little bit about myself. I am a military spouse. Our organization is called We the Veterans, but we say that it's silent and military families at the end of the title. We are a pro-democracy organization, and that sort of encompasses many things, but what I'm here to talk about today is something that's sort of right in front of our face, which is the upcoming 2022 midterm elections. And we have a completely positive, completely nonpartisan approach to an opportunity for veterans and military family members to serve again in a way that, like military service, bolsters our democracy, protects our freedom, and helps the rest of the country kind of move away from some of the really nasty partisanship that we've seen, especially in recent years. And that program is called Vet the Vote. The next slide. So let me just tell you a little bit about what we're trying to address. There is, as you've probably heard, a poll worker shortage. So coming up for the 2022 midterms in a couple weeks, there has been a lot of talk about the need for more poll workers, and that poll workers are incredibly important. They're Americans who volunteer but get paid. So this, similar to military service, you have to raise your hand and say you're willing to do the job. You have to do the training, but you do get paid. In LA County, you get paid $100 for your day of poll working and $80 for your training time. So this is a job that Americans need in order for our elections to run smoothly. We like to say that democracy runs on elections and elections run on these volunteer poll workers. And it takes time to find poll workers, to make sure they're trained, to get them to their location where they're going to serve for that day, and to sort of, give them the basic training they need. Next slide, please. So we saw an opportunity as an organization, a new organization, where, we know that poll workers are hard to come by, and that people have been afraid to do this job. They've been afraid because of COVID. There have been some even threats against people who work the polls. And the vast majority, 60% of poll workers in the last midterms were over the age of 61 and a quarter over the age of 70. So we saw this again as an opportunity. Wow, America needs a new pool of people to serve in this incredible, important role for our democracy. And we thought that veterans could be part of the solution. Next slide, please. So as you can see, just to sort of reiterate the challenge, it's not just to say, yes, we need the people to actually do this job and make sure that our polling locations are staffed, is that we need confidence in our elections. As military family member myself, and with my community of co-founder veterans, we think it's really important that America recommits to all being united around sort of the sanctity of our elections, and how important it is that we believe in the democratic process and in the norms. I mean, that is what my husband and veterans fight for, is to protect our democracy and protect those norms. And so we see it as a real front to our patriotism that people would question whether or not our elections are secure. Next slide, please. So we see the opportunity. It's very clear. Veterans and military families can break the cycle. There's always new veterans of all different ages. It doesn't matter what age you are to serve as a poll worker. And our community is incredibly well positioned to do this work. We're diverse, we're all over the country, and we're highly trusted by the American public. And so that's something that we see as a double benefit. Not only people who know how to do a job in service to the country, but who are trusted to do that job well. Next slide, please. Our call to action is really simple. It's to recruit as close to 100,000 veterans and military family members to be poll workers, and to have that become the new norm in poll working, so that going forward, we would run this campaign as long as we need to, and then we'd hopefully be able to shut it down and be able to say, listen, there is now a norm, as when people exit the military, one of the things that they choose to do is to sign up where they live to become a poll worker, and there won't need to be new recruiting drives every couple of years as elections come up, but instead we would have this evergreen population that would constantly refill itself and would be a very well-trusted, very well-trained group of Americans, veterans and military family members, to do this job. Next slide, please. We are super, proud of how we've been accomplishing the mission. We've been raising awareness about the need. We've been making it really easy to sign up and serve. And we've been sort of talking to people like you and our fellow veterans and military family members to try to sort of gather support from this different community who has not specifically been called in this way before. And that's what we were sort of excited to step into this work. There's been a lot of movement around trying to engage poll workers from different communities, but no one had sort of come to us as a community of veterans and military family members specifically. And we're proud to be the first one. Next slide, please. So how are we doing? Leading up to Election Day 2022, we started in the middle of the summer. We launched on July 4th. And since then, we have recruited 61,800 veterans and military family members through our site alone to be poll workers. We've done that with a coalition of 27 veteran service organizations and military support organizations, 3 civics organizations, the Chamber of Commerce, and the NFL. We have a Vet the Vote PSA running throughout the football season, and we've been in a bunch of news articles talking about this incredible opportunity for veterans to fill this job. We also plan after Election Day, as important as our work is in recruiting veterans, but to sort of capture the stories and to talk about this new norm of civic engagement for veterans and military family members. We want the rest of the country to see that when they went to the polls, the people that did that job diligently were likely to be veterans and military family members. And so they can trust that those folks were there making sure that things ran smoothly. And so again, we're not, questioning whether or not different elections bureaus and all these different specificities. We're saying we just want to funnel in vets and military family members to those jobs because we know they are a more trusted group, and that maybe more Americans will sort of put down their fears and suspicions that things are not being run well because they'll know that this trusted group of Americans was on the job. Next slide, please. So this is just some of our growing list of coalition members and supporters. There's been many more since this slide was initially put together, but we are so proud to have a broad and diverse group from across the veteran and military family community that is supporting us and helping us to make this happen. Next slide. And just a little bit about our organization, We the Veterans. You can go to the next one. We started as a nonprofit, totally nonpartisan, a group of veterans and military family members, because we really are committed to being in support of our democracy and building a more perfect union. And we believe that our population of veterans and military family members is the most well-suited to strengthen democracy during these tough times. So we take a totally positive approach about what veterans and military family members have as skill sets and innate traditions and communities, and that we are so well suited to being the folks that sort of help realign our common patriotism across the country, across party lines, across different lines. That's what veterans are most well suited to do. So just the next slide quickly. Our approach is to take on any issue that affects our democracy. We really like to build coalitions. So any organizations that are here today that are interested in this work, in this sort of pro-democracy platform, we're here for it. We're happy to have you join us. I know Ingrid, my colleague, put her email in the chat. We're all about strengths. We are not about, all the negative narratives about veterans, which of course are real and need to be addressed, but we are all about the strength of our community and about how well we can work together as a community to sort of advance the mission for America. And we are very, very specifically and explicitly nonpartisan. So we are not taking a position on who wins or loses. We're taking the position that it's best when democracy works well, and we should all be trying to make sure democracy works well. Next slide. So our priorities beyond our work with this election cycle and today are to just increase general civic engagement of veterans. We have a bunch of other ideas for that, so welcome any other conversations of people on the call. We want to reduce the impact of misinformation on all sides. We want to prevent any violent extremism on any side that affects our democracy, and we want to represent well our community of veterans and military family members. So the last slide. It's really simple. Go to vetthe.vote, and we funnel all the veterans who come, military family members who come through us, down to their localities. Training and the process of being a poll worker is done locally. America is really proud of that. And it's something that we find as an organization kind of frustrating, but also we respect the way our country operates in this way. So we don't do the hands-on training, but the different localities where you would be registered as a poll worker do. If they need you, they call you. We want to make sure that that bench is deep so that when they need people to sort of be called up to do the job, they're ready. And we want that bench to be filled with veterans and military family members. And I think the last question I just had before opening up to any questions is, anyone on this call already signed up to be a poll worker? Would love to hear from you. And that's the end of the slides, Amy, if you want to take them off. If anyone is a poll worker, I'd love to hear it, or if there's any questions. Oh yeah, Chris.
Good morning. I'm not a poll worker. I just, something kind of jumped in my head as you're giving this presentation. Do you have a a connection to the American Legion or the VFW?
We have talked to the American Legion, who has been super supportive of pushing out our information to their community. We have not had a national connection to the VFW. We've talked to some local chapters who've been super supportive and awesome, but we have not been able to sort of get that national organization to join our coalition, which we would love. So any connections there would be awesome.
Okay. I mean, I can't promise any connection certainly on a national level. It just seems like a natural fit to me. I mean,
Yeah.
a lot of Legion VFW members they have free time, and I'm sure they wouldn't mind getting $100 a day to do something, to support democracy, to support America.
Totally agree. Yeah, and Legion is already a pretty civic-minded organization, and that's really, that's the only other one that's sort of been in this space in many ways, in encouraging, the process of civics. Again, not politics, right? But civics, sort of, all the stuff surrounding the partisan stuff is what we're all about. Anyone else? Any other questions?
Yeah, we tried to sign up, a bunch of us, about a month ago, after receiving an email invitation, and we got all done, submitted all our COVID certificates and passed, every requirement. And then at the end, it said, well, this is only for employees of LA County government, and everybody else would be a volunteer. And then it dropped it and never contacted us back for how to take the training or anything. Well, we were interested in having some of the veterans in the area serve as paid poll workers at the $80 for training and $100 a day would help them out enormously. So then we applied again last week and got the same runaround. After you apply, it says you can only work as a poll worker if you're a employee of the county, and they have to provide an employee ID number in order to proceed. So there's a glitch on the system. So we've emailed them, and I know Ingrid Sundley just sent a message on the chat saying a lot of these election offices are overworked. But they have the app set up incorrectly, that you're invited to apply as a poll worker.
Yeah.
Okay, but then you can't go through unless you're a county employee. So I'm hesitant to publicize this to the 3 big veteran nonprofits who have breakfast 3 days a week up here in the Antelope Valley in Palmdale and Lancaster, if they're going to get the runaround too. Can you help at all?
Yeah. So first of all, it's funny, Laurel, that you said that, because before this call, I was just checking the LA County site. And the first thing that came up for me was also, when I just Googled it, was if I was a county employee. So that's interesting. That seems like something on the LA County side of things that is a glitch. Exactly. Like I saw the exact same thing you did, funny enough, when I just Googled it from my computer. So let me see if we can dig around a little bit. I know Ingrid got your information, and we'll see if we can figure out why they're pushing. The only thing I can think of, which would actually be good, is if LA County itself is already oversubscribed for citizen volunteers. One thing that we have learned in being a new organization about this space, and we're pretty aggressive, we're military family members of veterans. We don't really take no for an answer easily. And we've been really frustrated. It's very hard to get data from each locality about exactly what their needs are and exactly what their recruiting goals are. And it's not because they're not really awesome, doing their job, sort of government workers. It's that a lot of this stuff is really, really hard to track. And that the needs kind of pop up right at the end when they say, oh, this many people didn't come to the training. This is how many we actually need. And so we would love to be involved, as we grow as an organization, and trying to streamline some of those systems and make them easier, even at the local level. So we're not there yet, but I will definitely check on the LA question. Because if we can get a good answer for you, we'd love for you to share it as an opportunity.
Thank you very much. Yeah.
Any other questions?
Any last questions or comments for any of the speakers for today? All right, that means Ellen, you did an amazing presentation that was very thorough.
Good.
We did go ahead and put those slides in the chat as well, along with the Women's Bureau presentation. That way, if you need more information, you could download that, share it with your coworkers, with your family, with your friends. Because again, it is very important what she mentioned, that getting people to feel comfortable with the democratic process. So Ellen, thank you so much for being here. Ingrid, thank you also for being here and to providing this important information. Next, Ms. Rocio Palmero from the program manager for Women Vets on Point, as well as the co-chair for the Women Veterans Working Group, would like to discuss the Battle Boutique that's coming up next Friday. Rocio?
Hello, everyone. My name is Rocio Palmero, and I am, as Amy has said, that I am the Women Vets on Point program coordinator. We are so excited. We are teaming up with Cal Vets. We are teaming up with the LAVC and with the VA to bring in this amazing program. And Jimmy actually spoke about it earlier. It is for women, by women, and we are excited to be providing not just great speakers such as Melissa Washington and Virginia Wimmer and Suzette Aguirre, but we also are going to be providing clothing, professional clothing for our veterans, as well as headshots and makeup touch-ups and hair. And why is this all important? Ignore this small caption of people, even though we make up 50%, women make up 50% of the population. And so we want to empower our sisters. We want to make sure that I think statistically, we are more likely to get a job and hold on to a job, but we are less likely to advance in those positions. And so the speakers that we're bringing together and the energy that we want to make sure that we're bringing together is that we matter. Our service matters. There is a sense of nobility to our service because nobody ever had to draft us. Nobody ever had to make us check in at the age of 18, but yet we served despite environments that aren't always friendly to us for whatever reason. And so we are just excited to be having this event. We are sending out, I know that it's been sent out before, but we're probably going to send it out again for the Battle Boutique. We're almost tapped out when it comes to vendors because we have so many people tabling it, but we really want to get the word out to our veteran sisters that we are here for them, that we see them, that we thank them, and that we want to support them, and that their service matters. And I just love that I get to come in on the tail end of these amazing presenters and get to speak about this I want to say collaborative, but I don't want to take away from the LAVC, but this joint effort, that's what I'm going to use, the joint effort to support our sister veterans. And so that's all I have. This event, wait, no, you probably should know when it is. It's on October 21st. It's taking place from 10 to 4 o'clock. Lunch will be provided for both our vendors and our participants. And if you'd like to donate, softly, gently use professional attire, please reach out to Amy or to myself. We are going and we are picking up all these outfits and we are storing them until the day of the event. So thank you again for your support. Thank you again for just being here. And my sister veterans, you guys are beautiful and you guys are noble and your service matters. Thank you.
Does anyone have any questions about the Battle Boutique or how they can be involved or how they can help spread the word? Please feel free to reach out to Rocio Palmero, Krishna Flores, or myself, and we can help share some of that information along with some of the asks we have from the community.